5, 4, 3, 2, 1.
Dr. Kovac, now that your office records are in evidence, would you be kind enough to refer to your records to the first date that you saw William Reiber as a patient?
That was on May 6, 1982.
Under the circumstances, what was the reason for the visit and what you did for him?
According to my chart, Mr. Reiber had a bursitis, which is an inflammation around the metatarsal joint, that is the bottom of the foot behind the little toe. Again, inflammation. We gave Mr. Reiber hydrotherapy, which helps to reduce inflammation and aids in circulation. We also put a padding on the area to take pain or pressure off the area when he walked.
How does hydrotherapy aid in circulation?
It is a combination of the temperature of the therapy, which is approximately about 97 degrees, and that the warmth itself stimulates circulation, and as does the agitation of the water.
Why did you want to stimulate circulation?
Well, bursitis, it generally gets more blood to the area and helps bathe the area and in turn reduces inflammation.
When was the next time?
December 16, 1982.
That is approximately 7 months later.
Correct.
Would you tell us what you saw then and what you did for him then?
The exact same thing.
The exact same thing.
Hydrotherapy, and also, well, this doesn't have padding this time, but the diagnosis was the same, bursitis on the left fifth MT joint.
In layman's terms, so when you say bursitis on the left MT joint, could you tell us what foot?
This is the left foot behind the little toe, and bursitis is generally inflammation with redness and swelling.
Redness and swelling behind the left?
Fifth toe.
And again, you gave him the hydrotherapy?
Yes, that is correct.
When did you see him again?
January 28, 1983.
83.
Yes, sir, and this time the diagnosis was left hallux, which is the great toe, infected other fibula aspects, and the fibula simply means the side of the big toe that is towards the little toe.
Which foot are we talking about?
The left foot.
When you talk about the big toe, what is that?
That is the first toe or the big toe, hallux or great toe.
What did you find on that visit?
There was an inspection on the fibula aspect.
And fibula aspect means?
Towards the little toe, tibial meaning towards the big toe midline of the body.
When you say infection, could you tell us what that means in layperson's definition?
Layman's terms, redness and pain upon pressure.
What did you do for him on that visit?
According to that visit, okay, this is not my handwriting, Dr. Bloodstein did hydrotherapy. Although it does not state that a sterile dressing was put on the toe, with this diagnosis it would be safe to assume it.
You don't know from that?
Yes.
That is Dr. Bloodstein who made the entry?
Yes.
As far as you know, that record reflects the hydrotherapy?
Yes, that is correct.
Could you go to the next one?
1483. Again, Dr. Bloodstein is there. There is on the bottom plantar, which simply means the bottom of heel of the left foot, there is an infected fissure, which is simply a crack in the skin. It's not unusual for germs to get into this crack and cause mild infection, and that was treated by incising and draining the infected fissure.
Incising and draining?
Cutting into and allowing any kind of pus to come out or any kind of infectious material.
Was that done by you or your associate?
Done by me, but Bloodstein started it.
When is the next time that you saw Mr. Reiber?
June 30, 1983.
Would you tell us what he presented at that visit?
Yes, on his right foot there was an ulceration, narrowpathic ulcers, which basically means that narrowpathic of the nerve endings were such that the feeling was not as great in that particular area. That is very commonly seen with diabetes. There was extra pressure under the fourth, fifth metatarsal heads on the bottom of the foot around the area where the ball of the foot hits the ground.
The fourth?
Around towards the middle toe and the ones next to it.
What was done at that time?
The hard skin around the ulceration was debrided.
What does that mean?
Scraped off to reduce the pressure area of the ulcer. If you reduce it, it tends to heal up rather quickly.
Continue.
Apply a Biozyme C dressing. Biozyme C debriding enzymes. It helps to clean the area and allow for the body to help heal itself.
How was that applied?
That is an ointment, and it is applied right over the ulceration, and then there is a sterile dressing gauze put on it.
Anything else?
2 of Biozyme was prescribed to Mr. Reiber and instructed to apply this to the wound twice a day. This is BID.
I see an entry there with the initials H202.
Yes.
What is that?
Patient received hydroperoxide. What is that? What is hydroperoxide? If you ever put it on your hand or spilled it, you would see a lot of bubbles. Those bubbles are oxygen, and it helps to kill any germs on the wound.
You say he was advised. He was told to do it by himself.
Yes.
Anything else on that visit?
That was the only treatment and advice rendered.
What did the PTR1WK stand for?
Patient returned 1 week.
What does that mean?
That we wanted to see Mr. Reiber back in the office to see in 1 week to see how he was doing.
Why was that?
He had an open ulcer on his foot.
Did you see him again?
Yes, July 7.
About 1 week later?
Yes.
And what did that visit reveal?
That the ulceration was responding to the treatment, that we had rendered and advice that we had given. The wound was debriding, scraped around the hard skin to reduce the pressure, and the patient was advised to continue as directed previously. And the fact it was showing improvement was needed again. That was Dr. Bloodstein's entry.
Did you ever do a blood culture to determine what the nature of the infection was?
It was a skin culture that was done on June 30th, and the results are in the chart after the 7-7 entry.
What did that reveal?
It reveals that there was a staphylococcus ulceration. Staphylococcus to the common person is contamination, which means it is very commonly seen on the feet in general, even without an infection.
Do you see Mr. Reber again?
Yes, 1 week after the 7-7 visit, we saw him July 14, 1983.
What did that visit reveal?
The fact that the ulceration was responding to the therapy, the treatment we were giving, and the patient was advised to continue the dressing as directed with the Biozyme C.